Clinicopathological, endoscopic, and molecular characteristics of the skirt, a new entity of lesions at the margin of laterally spreading tumors. Introduction. Although there is a low incidence of small conventional adenoma in the rectum, large laterally spreading tumors are frequently found in the rectum rather than in the colon. LSTs are thought to be precursor lesions for colorectal cancer, although it is difficult to identify patients with a high risk of developing rectal cancer by endoscopic examination alone. Surgical interventions for advanced rectal cancer may reduce a patient's quality of life. Therefore, it is important to detect rectal cancer when it is still at an early stage or when there is only a precursor lesion present. For early rectal lesions, including LSTs, there are two therapeutic approaches: surgical transanal treatment and endoscopic treatment involving endoscopic mucosal resection, EMR, or endoscopic submucosal dissection, ESD. Endoscopic treatment is a therapeutic technique and an important diagnostic method that can be used for total incisional biopsy. Some lesions greater than 20 millimeters in size require en bloc resection. This is best achieved by ESD. EMR is the least invasive and simplest of all these procedures. However, it is technically difficult to perform en bloc EMR for a lesion with a diameter of greater than 20 millimeters. However, high recurrence rates have been observed after surgical transanal treatment, whereas the recurrence rate after endoscopic resection is much lower. Depending on the indication, the resection area can be evaluated using indigo-carmine staining and magnifying endoscopy before ESD in order to identify a skirt carefully, i.e., a slightly elevated flat lesion with wide pits at the margin of LSTs. In a previous study by our group, the authors reported that the incidence of skirts was higher in the rectum, 17%, than in the colon, 0.5%, and that almost all skirt lesions were accompanied by rectal LSTs of a granular nodular mixed type, LST-GM. The endoscopic characteristics of the skirt surface are similar to those of a hyperplastic polyp. However, skirt lesions are often pathologically diagnosed as low-grade dysplasia, LGD, which is not consistent with the endoscopic findings of a skirt. The definition of a skirt was originally based on endoscopic examination alone, and because the pathological characteristics of skirts remain unclear, they are not yet defined on the basis of pathological findings. Furthermore, the relationships between genetic alterations in the skirt and LST regions are unclear. Alternative pathways through mutations in KRAS and BRAF genes are associated with the progression of colorectal polyps to cancer and may provide insights into the genetic characteristics of skirts. A multi-gene cancer panel utilizing Luminex technology was developed recently. Therefore, the aim of the current study was to investigate in detail the pathological characteristics of skirts, clinicopathological characteristics of LSTs with and without skirts, endoscopic characteristics of skirt lesions, and genetic alterations in LSTs with skirts. Background and study aims. A slightly elevated flat lesion with wide pits has occasionally been observed at the margin of laterally spreading tumors, LSTs, and is known as a skirt. The aim of this study was to evaluate the clinicopathological, endoscopic, and genetic characteristics of a skirt. Patients and methods. Consecutive LSTs were examined to evaluate the pathological, endoscopic, and genetic characteristics. Pathological characteristics, including the dimension of the cryptic opening, DCO, width of the individual gland, WIG, DCO to WIG ratio, and microvessel diameter were elucidated and compared with those of hyperplastic polyps, low-grade dysplasia, LGD, and normal mucosa. The endoscopic findings of pit and microvascular patterns were assessed. Gene mutation analyses were performed for the KRAS, BRAF, NRAS, and PIK3CA genes. Results. A skirt was identified in 1,023 LSTs, and 80% of lesions with a skirt had a component of either intramucosal or submucosal adenocarcinoma. The DCO, WIG, and DCO to WIG ratio of the skirt were significantly larger than those of other lesions. The microvessel diameters in skirts were significantly smaller than those in LGDs. Regarding the endoscopic findings, 30 skirts showed pits with a coral reef-like appearance, and all skirt regions were found to have a type 1 capillary pattern. KRAS mutation at codon 146 was found in the nodular part in 1 of 5 LSTs with a skirt. Conclusion: the skirt is a newly identified lesion distinct from hyperplastic polyps and LGDs, suggesting the presence of a novel pathway for rectal carcinogenesis from LSTs with a skirt.